So hello and welcome. In this video we will discuss about humerus bone of upper limb. So in this humerus bone we will discuss both proximal as well as the distal end, and we will also discuss anterior as well as the posterior view. So now let's see in this picture. If you'll see in this picture, then we can see this one is your posterior view. So this one is your posterior view of humerus bone. In posterior view you can see here, this one is your head. I'm drawing with red color. So this one is your head of humerus. So what's this? Head. After head you can see here protuberance here. Actually this one is your tubercle, that is called greater tubercle, right? So after head you can find greater tubercle. Then you can find here attachment for your triceps brachii muscles. So what is this? You can find on the superior portion. This one is longitudinally, you can see here. So longitudinally rough surface on the posterior view on the superior aspects. So you can find diagonally there is a rough surface on the superior aspects of your shaft, that is for the attachment of your muscles, triceps brachii muscles. So this one is for attachment of triceps brachii muscle. So after this attachment for the triceps brachii muscles, after this rough surface you can find here groove. I'm drawing with a blue color, you can find here. So this one is groove. That groove is called a radial groove. That one is called radial groove. So this radial groove is on the middle part of the posterior surface. So on this posterior surface it is present on the middle part, and it passes diagonally down the bone. You can see here this is parallel to this rough surface. So this passes diagonally down the bone, and it will pass until your deltoid tuberosity. So I will also discuss about deltoid tuberosity. So in this radial groove there is a passage of the artery, that is your profunda brachii artery. Profunda brachii artery, and the one nerve also passes through your radial groove. That nerve is your radial nerve. So this is important question they will ask, like which artery and the nerve passes through the radial groove. And here you can find out, I'll draw with green color. So this one is your, you can find out the triangular area here. So this triangular area is called deltoid tuberosity. So this one is actually rough and triangular, right? And it is on the anterolateral surface, right? So this one is present on your anterolateral surface. As from the name you can see it's deltoid tuberosity. So it is for the attachment of deltoid muscles. So this one is your posterior view of your humerus bone. So now we will do a quick revision. So this one is your head on the upper surface. After head there is a greater tubercle. After the greater tubercle you can find out there is the radial groove, and then there is a deltoid tuberosity, and there is the attachment of the triceps brachii muscles. So now we'll discuss in another picture about the distal end. So here let's see about the distal end. So in the distal end, so we have two picture here. One is your anterior view, another one is your posterior view. So I'm writing here, this one is your posterior view. Why it's posterior view? It's because of your olecranon fossa here, and this one is your anterior view. And this one, both are distal end, right? Distal end of humerus, anterior view and the posterior view. Here what we will learn, there is a presence of condyle, then epicondyle, then fossa. So if we'll talk about condyle, there is two condyle, capitulum and the trochlea. So I will draw with red color. So here you can see this one is your capitulum, and this one is your trochlea. So if you'll see in this picture, this capitulum is actually hemispherical in shape, and this trochlea is pulley shaped. So in the picture you can see this is pulley shaped trochlea and the capitulum is hemispherical in shape. So your trochlea is found on the medial side. So this one is your medial side and this one is your lateral side. So trochlea is found on the medial side and the trochlea is in pulley shaped, and the trochlea articulates with your ulna. So it articulates with the ulna, and your capitulum articulates with the radius bone, right? So after that, two condyle, there is two epicondyle. One is your medial epicondyle. So medial epicondyle is present above your trochlea. So this one is your medial epicondyle here. This one is the large bony protuberance. You can see this bulging part is more as compared to this one, right? So this one is your lateral epicondyle, and this one is your medial epicondyle. So if you'll see in this picture, medial epicondyle is large bulging part, but lateral one is small as compared to medial one. So medial is present on the side of your elbow, or medial is also present on the side of your trochlea. Now we have three fossa. So if we'll talk about the fossa, first one is your coronoid fossa. So I will draw. So this one is your fossa. This one is your coronoid fossa. So coronoid fossa is superior to trochlea, and it is adjacent to radial fossa. So this one is your radial fossa. So if you'll see in this picture, coronoid fossa, right? It is coronoid fossa is superior to trochlea. So this one is your trochlea here. So this one is your coronoid fossa is superior to trochlea, and your radial fossa is superior to your capitulum, right? Then we have another fossa, that is olecranon fossa, which is present on the posterior view. So this one is trochlea here, posterior view, and this fossa is your olecranon fossa. So this one is your olecranon fossa. I will write again. So in the distal end of the humerus we have two epicondyle, then condyle, and then we have three fossa, right? So please you can see this picture, you can see if this video is good or bad. You can give a comment here. I will upload another video. You can like this video, and you can subscribe my channel so that you can view another video also.